Hello, Yone. Really good. Nice to see you.
How is London?
Yeah, London is great. It's a bit grey and cold, but that's London.
And how is work?
Work's very good. Very busy at the moment.
Right, so I have some questions here from my students.
Yeah.
So I'm gonna start straight away.
Okay,
I
shoot.
have a question from Jan, and he is asking, how does HIV affect you on a daily basis?
Right. So I've been diagnosed HIV positive for about 7 months now, and since then, all that's changed really is I had to add to my routine a few pills. I just have to take basically 3 pills every day at the same time. Some people take one pill, which is three combined, and some people take a combination of 3 up to 6 pills, depending the type of HIV virus they have. Other than that, I can still eat anything I want. I feel healthy. Nothing's really changed.
From Taye, and he wants to know, how do you think you were infected?
Well, I'm pretty sure that I've contracted HIV by having unprotected sex with a partner. The main problem these days with HIV infections is that most people don't know they're infected, as it can take up to 6 weeks for you to show on blood tests. So people who practice the unsafe sex with different partners, they are putting themselves on a regular basis. They are putting themselves more at risk of contracting HIV and then passing it on without even knowing they had it in the first place. And I've always had boyfriends. I've always had stable relationships. But after breaking up from my last relationship last year, then I met someone who I was seeing on a regular basis, and he was quite irresponsible, I suppose. We just didn't get tested. We didn't really think about it, and then we just had unprotected sex, and so it's possible that he didn't know he had it.
Yeah. Mm. Mm. Eric wants to know, how do you feel? Like, how does it feel like to be HIV positive?
Well, it feels pretty normal, really. I know that some people they can have side effects such as depression, anxiety, diarrhea. They can feel nausea. They can feel very tired, and that can happen within the first 2 weeks that you start your treatment. But it can take up to 6 months for you to develop any sort of side effects. I can say that I've had maybe a little bit of anxiety, more than usual in the past 6, 7 months. But other than that, I suppose I've been quite lucky. But only 15% of people that are on treatment experience side effects. So that's pretty normal, really.
Hmm. Mm. Then Anne wants to know about your environment. So what do people around you think of you?
Well, when I had my diagnosis, I was very quick to go public with it, and I think in my reaction, it really triggered a cascade of support from friends, family, work colleagues, even clients of mine were emailing me and texting me, just saying, "Wow, you know, what an inspiration you are to come out, from a subject that is so taboo and nobody talks about." So I don't really think anyone thinks less of me. And in the end, it doesn't really matter if people.
Actually, can I ask you something?
Yeah.
You mentioned clients, but my students don't know what your job is.
Oh,
Could you
yes.
tell them?
So I'm a physiotherapist. So I work with people one to one, doing massage, doing treatment. So it's always it's a very yeah. I establish very close relationships with people in the end. Um,
Mm.
yeah. So but in the end, it doesn't matter what people are gonna think about you. People are gonna judge you anyway. So what really matters is how you feel about yourself.
What made you go public? Like, what happened?
So the reason that I went public with my diagnosis is that I start telling a few of my friends, and then suddenly some of these friends, not all of them, but maybe 20% or 10 to 20% of these friends came back to me and said, Bruno, I'm also HIV positive. And I just thought, this is so weird. Why didn't I know this before? I know you for 15 years and I know you for 6 years. And suddenly there's this little secret society or secret group that nobody knows about it because they feel ashamed or they feel, I don't know, they feel less of the, people are going to think less of them. So I was just a bit shocked that all this was happening in the background. And I decided to go public because so people can realize that actually HIV doesn't just happen to people who engage in risky behavior and take drugs and are part of that group. It can happen to anyone. Look at me. I've always had boyfriends. I've always been very good. I don't take drugs. I don't go out clubbing. It's so yeah. That's the reason.
I have another question from Isabella. She wants to know what was your reaction when you found out you were HIV positive.
So that's so I was quite shocked, and I couldn't quite believe it, and I did feel like a sense of helplessness. That it was almost like I was having a bad dream that I really couldn't wake up. It was very strange. I never felt anything like that, and it took me a good month to get my head around it. And I think after 2 weeks, I told my parents already, and I told some friends straight away. I just called them and I just told them, and the more I told my friends, the more support I got from people, and I don't know. I just feel like I really got over it a lot quicker. Because I know people that haven't told almost anyone, and they've taken a year and a half, almost 2 years to get over the fact that they're HIV positive. And that's just crazy. That shouldn't happen like that.
Eric wants to know, how did you find out you were HIV positive?
So the way you find out is by going to a sexual health clinic. So they should be, in London they're everywhere, and most major cities will have a sex health clinic. But otherwise, you can just go to your doctor and ask for a test. People that are having unprotected sex on a regular basis, they should get tested regularly. I used to go for a test every 3 to 6 months because HIV is not the only thing you can catch anyway. So I was just making sure. So that's why I just because I had an episode of unprotected sex, I thought, well, I might as well. I should go and get tested, and that's how you do it.
So, Bruno, you told us how you got quite a lot of support from people around you, but Tyreek, he wants to know how does it feel telling people you are HIV positive?
So for me, it was quite liberating, and I'm so keen to talk about it and bring it up during conversation that whenever I have the opportunity to do it, I just do it. People can get a little bit shocked and a little bit surprised because it's just not a topic. People just don't talk about it. But so far, I haven't had one bad reaction. Everybody's been engaging, everybody's been supporting, and as long as you know the facts, as long as you know what you're talking about, people, they're not gonna challenge you or they're not gonna point a finger, or as long as you know what you're talking about. And even if they do, you could just, you know what you're talking about. You just stand your ground and you just, put your point across. And
Now we have a bit of a weird question from Taku.
Okay.
He asked, what would you sacrifice if you were able to remove the HIV from you?
Okay. Yeah, I can understand why he's asking that.
Yeah.
But I honestly, if I had to sacrifice something, I wouldn't do it. I mean, if there was a vaccine tomorrow, I'll be the first in the queue to get a vaccine, because I don't really want to be taking tablets all my life, and I'm sure a vaccine will come along someday. But if I had to sacrifice something, I don't think it would be worth it, because my life hasn't really changed that much with the HIV.
Well, I know you're a very active person. Then Moscan asked if has HIV stopped you from doing what you wish to do in life?
No, not really. If anything, it's pushed me to do even more because a diagnosis like HIV or cancer or diabetes, it just puts things in perspective. So you really think, what do I want to do in my life? Am I doing the right things for me? So it really makes you reassess. So actually, I just become more active. I'm traveling more now. I've joined a volleyball club. I mean, I'm doing lots of new stuff. So I'm loving it.
You even went dancing with me in the summer. You remember?
Yes, that's right. We did.
Cindy wants to know, quite straightforward, do you feel any pain in your body?
No, you don't feel any pain. As I said, some people can have initially some side effect like diarrhea or nausea, but once that's passed, it's gone, and I never felt anything like that. So no pain, only goodness and happiness.
Great. Then Jan wants to know, do you regret any decisions prior to contracting HIV?
I guess my only regret would be not to have looked after myself, because when you have unprotected sex without the information of is that person HIV negative, am I HIV negative? When you don't have that information and you just do it anyway, that's irresponsible. So I suppose my only regret is not having been more responsible in that respect. But then again, you can't really regret too many things in your life. What happens, and it happens for a reason, and they shape you into the person that you are today, and so it's okay.
Well, thank you so much for answering all these questions from our students.
That was a pleasure.
It's been great.
Take care. Bye bye.
Love you.
Love
Bye.
you too. Bye.